Hello everyone. Today we will discuss about the first and the second cranial nerve. The objectives are to learn about the cranial nerves, their functional grouping and the functional components, their nuclei, and the first cranial nerve, that is olfactory nerve, and the second cranial nerve, optic nerve, and their clinical anatomy. So there are 12 pairs of cranial nerves. That includes the first is olfactory, second optic, third oculomotor, fourth trochlear, fifth trigeminal, sixth abducent, seventh facial, eighth vestibulocochlear, ninth glossopharyngeal, 10th vagus, 11th is accessory, and 12th is hypoglossal nerve. So here you can observe the position of the different cranial nerves, the first, second, the third, fourth, fifth in the pons, sixth, seventh and eighth at the junction of the pons and medulla, ninth, 10th, 11th and 12th cranial nerves. So their position, most of them are present in the ventral aspect. So in the dissected part in another diagram you can observe the cranial nerves, they are represented by the black dots. So all the cranial nerves emerge from the ventral brain except the trochlear nerve. So they supply the muscles of the eyeball, face, palate, pharynx, larynx, tongue and two large muscles of neck. Along with this afferent to the special senses like smell, sight, hearing, taste and touch is also present. So some nerves form the afferent loop and others form the efferent loop of the reflex arc. So the cranial nerves can be grouped into three, that is they may be purely sensory or mainly motor, or they are having both sensory and the motor components. The purely sensory group includes the cranial nerves 1, 2 and the 8. Mainly motor, that is the major component is the motor, that includes the cranial nerve 3rd, 4th, 6th, 11th and 12th, and mixed, that is it includes both the sensory and the motor component, that includes the cranial nerve 5, 7, 9 and 10. So purely sensory cranial nerves include, we have seen the cranial nerve olfactory nerve, that is concerned with the smell, the second cranial nerve optic concerned with the vision, and the third, that is the cranial nerve 8th, that is vestibulocochlear nerve, concerned with hearing and balance. So all these three, the functional component is the special sensory fibers. The mainly motor cranial nerves includes the cranial nerve 3, that is oculomotor, the cranial nerve 4 trochlear, the 6th abducent and the cranial nerve 11th the spinal accessory and 12th hypoglossal. So all these having the functional components, that is the skeletal motor fibers. The mixed cranial nerves includes the cranial nerve 5, that is trigeminal, 7 the facial, 9th glossopharyngeal, 10th vagus. So they carry the motor and sensory fibers and also the somatic and visceral fibers. So coming to the embryology part of this development of cranial nerves, so the development of functional columns. So during the development of the spinal cord, due to the appearance of longitudinal groove, that is the sulcus limitans, the lateral wall of the neural tube is divided into two parts or laminae, that is the dorsal alar lamina and the ventral basal lamina. The cells of the basal lamina are motor, whereas the alar lamina are sensory in function. So the cells of each of these two laminae gets arranged into two longitudinal columns, the somatic and the visceral. The visceral components lying close to the sulcus limitans. So, here we can observe the general somatic afferent, general visceral afferent, the general visceral efferent and general somatic efferent. So, during the development of the hindbrain, the two significant events occur. The neural tube widens to form the fourth ventricle. So, the alar laminae are splayed apart like opening a book. The functional components undergo a directional change from ventrodorsal to ventrolateral. So, an extra bronchial column appears between somatic and the visceral columns. So, in both basal and alar laminae to supply the derivatives of the pharyngeal arches. So, apart from this, an extra special somatic column appears in the most lateral part of the alar lamina to receive the sensations of hearing and balance. So, thus there are 7 functional columns in the brainstem. So, that includes the motor columns, the general somatic efferent, the special visceral efferent, the general visceral efferent. And in sensory columns includes the general visceral afferent, special visceral afferent, general somatic afferent and special somatic afferent. So, the functional components we have seen one by one we will discuss. The first is general somatic efferent. These nuclei supply the skeletal muscle of somatic origin. So, that includes the oculomotor nucleus situated in the midbrain at the level of superior colliculus. Its fibers enter the oculomotor nerve and supply 5 extrinsic muscles of the eyeball except the lateral rectus and superior oblique. The second one includes the trochlear nucleus that is situated in the midbrain at the level of inferior colliculus. It supplies the superior oblique muscle through the trochlear nerve. So, here you can observe these through, that is third and fourth nerve at the level of the midbrain. MB represents the midbrain. Then the third component, that is third division, includes the abducens nucleus that is situated in the lower part of the pons. It supplies the lateral rectus muscle through the abducens nerve. Then the fourth one is the hypoglossal nucleus. It lies in the medulla. It is elongated and extends into both the open and closed parts of the medulla. It supplies most of the muscles of the tongue through hypoglossal nerve. So, the second component, that is special visceral efferent. So, this nuclei supplies striated muscle derived from the bronchial arches. So, it includes the motor nucleus of trigeminal nerve, lies in the upper part of the pons. It supplies the muscles of the mastication through the mandibular nerve. Then the nucleus of the facial nerve that lies in the lower part of the pons. It supplies the various muscles innervated by the facial nerve. The nucleus ambiguus lies in the medulla. It forms an elongated column lying in both the open and closed parts of medulla. It supplies the stylopharyngeus muscle through the glossopharyngeal nerve and the muscles of the pharynx, the soft palate and the larynx through the vagus and the cranial part of the accessory nerve. So, next one is the general visceral efferent component. These nuclei give origin to the preganglionic neurons that relay in the peripheral autonomic ganglion. The postganglionic fibers arising in the ganglion supply smooth muscle or glands. So, the Edinger-Westphal nucleus lies in the midbrain in close relation to the oculomotor nucleus. Its fibers pass through the oculomotor nerve to ciliary ganglion to supply the sphincter pupillae and the ciliaris muscle. The lacrimatory nucleus lies in the salivatory nuclei in the lower pons. It gives off fibers that pass through the facial nerve and its branch, the greater petrosal nerve, to relay in the pterygopalatine ganglion and supply the lacrimal, nasal and palatal glands. So, the superior salivatory nucleus lies in the lower part of the pons. It sends fibers through facial nerve and its cauda tympani branch to the submandibular ganglion for supply of submandibular and sublingual salivary glands. The inferior salivatory nucleus also lies in the lower part of the pons just below the superior nucleus. It sends fibers through the glossopharyngeal nerve to the otic ganglion for supply of the parotid gland. And the dorsal nucleus of the vagus is a long column extending into the open and closed parts of medulla. It gives off fibers that pass through the vagus nerve to be distributed to thoracic and abdominal viscera. So, the ganglia is concerned are present in the walls of the viscera that it supplies. So, next we are having the general visceral afferent and the special visceral afferent. The only nucleus in this category is the nucleus of solitary tract or tractus solitarius. It lies in the medulla and extends into both its closed and open parts. It receives general visceral sensations as follows, that is, it through the glossopharyngeal nerve from the tonsil, pharynx, the posterior part of the tongue, carotid body and the carotid sinus. Through the vagus nerve from the pharynx, the larynx, the trachea, the esophagus and other thoracic and abdominal viscera. It also receives the sensations of taste, that is the special visceral afferent, that is from the anterior 2/3 of the tongue and the palate except circumvallate papillae through the facial nerve, from the posterior 1/3 of the tongue through the glossopharyngeal nerve including the circumvallate palatate, and from the posterior most part of the tongue and from the epiglottis through the vagus nerve. Next is the general somatic afferent nuclei. These are all related to the trigeminal nerve. The main or the superior sensory nucleus of the trigeminal nerve lies in the upper part of the pons. The spinal nucleus of the trigeminal nerve descends from the main nucleus into the medulla. It reaches the upper two segments of the spinal cord. The mesencephalic nucleus of the trigeminal nerve extends upwards from the main sensory nucleus into the midbrain. So, these nuclei receive the exteroceptive sensations, that is touch, pain and temperature, from the skin of the face through the trigeminal nerve and from a part of the skin of auricle through the vagus through auricular branch and through the facial nerve. Proprioceptive sensations from muscles of mastication reach the mesencephalic nucleus through the trigeminal nerve. The nucleus is also receive the proprioceptive fibers from the ocular, facial and the lingual muscles. So, next nuclei is the special somatic afferent. So, it includes the cochlear nuclei which is present in the dorsal and the ventral. It receives the impulses of hearing through cochlear nerve. And the vestibular nuclei situated superior, spinal, medial and lateral that receive the fibers from the semicircular canals, the utricle and the saccule through the vestibular nerves. So, muscles of the facial expressions of lower face are supplied only from the contralateral motor cortex. So, in this table I have summarized the functional components, that is general special efferent, that will be including oculomotor nucleus, trochlear nucleus abducent nucleus and hypoglossal nucleus. Special visceral efferent, that includes the motor nucleus of trigeminal nerve, motor nucleus of facial nerve and nucleus ambiguus. Then general visceral efferent includes the Edinger-Westphal nucleus, lacrimatory nucleus, superior salivatory nucleus, inferior salivatory nucleus and dorsal nucleus of vagus nerve. The general visceral afferent and special visceral afferent includes the nucleus of solitary tract. General somatic afferent includes the trigeminal nuclei of that is sensory nuclei of trigeminal nerve, that includes the chief, the mesencephalic and the spinal part, and the special somatic afferent includes the vestibular nuclei and the cochlear nuclei. So, in this diagram you can see the exact positions of these nuclei in the brain. So, this is another table showing the functional components, the nuclei distribution and the functions. So, today we are learning about the first and the second cranial nerve. So, the first cranial nerve, that is olfactory, the functional component is the special somatic afferent nuclei. Then its distribution is to the olfactory epithelium and the function is smell, whereas the optic nerve, that is second cranial nerve, again the functional component is special somatic afferent. It is distributed in the retina of the eyeball and the function is the sight or the vision. So, all the 12 cranial nerves distribution and functions you can go through this table. So, now the olfactory nerve, that is the first cranial nerve. The component is the sensory and the function is smell. The origin is from the olfactory receptor nerve cells and the opening to the skull through the openings in cribriform plate of ethmoid. The receptors includes the olfactory cells. It is about 16 to 20 million in man. They are bipolar neurons. So, they lie in the olfactory part of the nasal mucosa and serve both as receptors as well as the first neurons in the olfactory pathway. So, the first neuron also includes the fascicles of the olfactory nerves. It is about 20 in number. It represents the central processes of the olfactory cells. The second neuron includes the mitral and the tufted cells in the olfactory bulb. It gives the fibers that form olfactory tract and reach the olfactory areas. So, here you can observe the olfactory tract. The third neuron, these are located in the primary olfactory cortex, that includes the anterior perforated substance and the several small masses of grey matter around it. The fourth neuron, the fibers arising in the primary olfactory cortex go to the secondary olfactory cortex or the entorhinal area located in the uncus and the anterior part of the parahippocampal gyrus. The smell is perceived in both the primary and the secondary olfactory areas. The clinical aspect, anosmia, that is loss of olfactory fibers with aging. Here the sense of smell is lost and the sense of the smell is tested separately in each nostril. Then allergic rhinitis causes temporary olfactory impairment, and the absence of the frontal lobe of brain or meningioma in the anterior cranial fossa may press on the olfactory bulb or olfactory tract, resulting in anosmia. In some head injuries, the olfactory bulbs may be torn away from olfactory nerves. It may cause the CSF rhinorrhea, that is the cerebrospinal fluid leakage through the nose. The uncinate fits, lesion of the lateral olfactory area may cause temporal lobe epilepsy or the uncinate fits. So, these fits are of imaginary disagreeable odors with the involvement of tongue and the lips. So now the second cranial nerve, that is the optic nerve. The component is the sensory component, the function is vision. The origin is back of the eyeballs and opening to the skull through optic canal. So the axons of the retinal ganglionic cells or the neurons project from the eye to the diencephalon that makes up the optic nerves and the optic tract. So here you can observe the optic nerve and the tract. The axon from the medial retina crosses over at the optic chiasma, and from lateral retina they do not cross. So the unique features of the optic nerve, it is not a peripheral nerve but a tract, that is a prolongation of the white matter of the brain. In the development of the eyeball we have seen, it is as the optic nerve develops from the stalk of the optic vesicle. It is covered by three meninges, that is pia, arachnoid and dura mater of the brain, and it is devoid of neurolemmal sheath. The fibers are myelinated by the oligodendrocytes. The peripheral nerve, they are myelinated by Schwann cells. So now the field of vision. There is a temporal field of vision and a nasal field of vision. So the field of vision are also upper and the lower. So there are four fields on each side, that is upper temporal and the lower temporal, upper nasal and the lower nasal. So there is a macular vision which is the most acute or sharp and colored vision. The nasal fields are smaller than the temporal fields. So here in this diagram you can observe the temporal part is represented bigger compared to that of the nasal part. The larger light temporal and the small right nasal fields of vision fuse to form the right part of the binocular field. The left halves of the field of vision, that is larger temporal half and the smaller nasal half of the left field of the vision form the left half of the binocular field. So the fibers from the nasal parts of two retinae decussate to form the optic chiasma and travel to the contralateral side of the optic tract. So here it is represented by the blue color. The fibers from the temporal hemiretinae continue ipsilaterally in the optic tract. So the right optic tract carries the fibers of right temporal hemiretina and the left nasal hemiretina and vice versa. So the macular fibers lie in the central part of the optic tract. The upper retinal fibers project downwards and the lower retinal fibers project upwards. Then the light reflex. The constriction of the pupils in response to light involves four sets of neurons. The afferent pathway starts in the ganglion cell layer of retina, which gives rise to the optic nerves. Then the fibers leaving the optic chiasma enter both optic tracts and terminate in the pretectal nuclei. So each pretectal nucleus is linked to its ipsilateral Edinger-Westphal nucleus by internuncial neurons. The contralateral Edinger-Westphal nucleus is reached by the way of posterior commissure. So this pathway results in the direct and indirect light reflex as the input to one optic nerve reaches both Edinger-Westphal nuclei. The preganglionic parasympathetic fibers enter the oculomotor nerve, leave the branch to the inferior oblique and synapse in the ciliary ganglia. The postganglionic fibers run in the short ciliary nerves and enter the iris to supply the sphincter pupillae. Now the pupillary dilatation. So the pupillary dilatation results from the sympathetic activity. The sympathetic pathway starts with the central neuron in the posterior hypothalamus, which as it descends is joined in the pons and medulla by the ipsilateral fibers descending from the reticular formation. The preganglionic neuron emerges from the first thoracic ventral nerve root to enter the paravertebral sympathetic chain, which runs up to the superior cervical ganglia. From there, the postganglionic fibers travel along the external and internal carotid artery. Some of the sympathetic fibers join the ophthalmic division of the trigeminal nerve in the cavernous sinus and then leaves this in the long ciliary nerve to supply the dilator pupillae. So, this pathway also supplies the Muller's muscle of the eyelids and sweat glands of the face. So, in the FAR response or in the presence of anxiety, stress or fear, the pupils dilate through this sympathetic activity. So, clinical aspect. So, the lesion of the retina leads to scotoma, that is, the certain points may become blind spots. The optic nerve damage results in a complete blindness of that eye. The optic chiasma lesion, if central, will lead to the bitemporal hemianopia, but if the peripheral on both sides will lead to binasal hemianopia. The complete destruction of the optic tract, lateral geniculate body, optic radiation or the visual cortex of one side results in loss of opposite of the field of vision. The optic nerve, if damaged, cannot regenerate because its constituent fibers are devoid of neurilemmal sheath. Papillar edema, it results due to increased intracranial pressure. It leads to the swelling of optic disc due to blockage of the tributaries of retinal veins. The optic neuritis, the lesion of the optic nerve that results in decreased visual acuity. Optic disc appears pale and smaller. The methyl alcohol is a usual toxic chemical leading to blindness. Next is the Argyll-Robertson pupil. In this condition, the accommodation reflex is present, but the light reflex is absent. The pretectal area is affected. Thank you.